बीमारी के बारे में हमने कभी सोचा भी नहीं है। उस बीमारी के बारे में हमको मतलब मेरे बेटी के साथ ऐसा कुछ है, ये कब और कैसे हो गया कुछ समझ में नहीं आया। मेरी बेटी तो कभी बीमार भी नहीं हुई है। खाना पीना, स्कूल उसका रोज़ का आना जाना, बस वही शरीर उसका हल्का सा वो पीला होते जा रहा था और दुबली होती जा रही थी। बगल में वो डॉक्टर हैं, उनको दिखाए, वो तो बोल रहे इनका मतलब शरीर में ब्लड नहीं है। तो हम लोग बस बीमारी तो यही है ना, ब्लड इसके शरीर में कम है, तो आम बीमारी है, ब्लड नहीं रहता तो फिर भी वो ब्लड चढ़ जाता, वो ठीक आता। मन में तो घबराहट थी, लेकिन यहाँ पे आए तो आते आते हॉस्पिटल में सब काम धीरे धीरे सब होना चालू हो गया। तब मुझे लगा कि हमारी बेटी को ये बीमारी है।
When the parents come first with the diagnosis, they are totally devastated. Their kid has a cancer, they are not coping up and they can't believe, actually they are in a denial mode that their child can have a cancer.
मेरा बचपन से ड्रीम था कि मुझे इंडिया एक बार जाना है, मेरा ड्रीम था, लेकिन डायरेक्टली इनडायरेक्टली ये तो मेरा पूरा हो गया। पर्सन को गुड और बैड दोनों सर्कमस्टेंसेस से फेस करना पड़ता है। कैंसर जैसे हमें पता चला और डिजीज़ का डायग्नोस जब इधर हुआ तो हम दोनों कुछ बोल नहीं पा रहे थे, हम दोनों ही स्पीचलेस थे, आँख में बस टीयर्स थे और हम दोनों एक दूसरे को देख के बोल भी नहीं पा रहे थे। जैसे मम्मी बेटी में होती है ना, बस हम लोग आगे कर रहे थे, दिन भर बस रो रहे थे।
Cancer is not a common disease. In fact, cancer word doesn't mean anything. It encompasses a lot many diseases. They have one thing fundamental in common, that is abnormal growth. So the cancer actually is a group of disease which have actually some abnormal growth. Some common symptoms that are associated with childhood cancer, like somebody has fever which is not going away and there is no obvious focus for this fever, then one may think of childhood cancer. Any incidental mass in the abdomen or in the chest or on the skin or extremity, it may be a sign of cancer. So every physician, every pediatrician who has first hand contact with the children, they should have responsibility to identify and to look for the abnormal signs so that they can be referred to appropriate units and they can be treated appropriately. The childhood cancer, roughly 40,000 to 50,000 new cases occur every year in India. Around 20 to 30% of them are diagnosed. Maybe 5% of them actually get proper treatment.
Our body is made of billions of cells, and if a cell starts proliferating without any check, it can lead to formation of cancer. Initially, most cancers are asymptomatic, but once these cells start multiplying and forming tumorous growths, then they can lead to disruption of the normal body function. Blood cancers can have symptoms related to the dysfunction of the blood components, which includes RBCs, so a decrease in the hemoglobin counts leading to anemia or pallor, decrease or disruption of the WBC function, which can lead to increased infections, a fever which does not go with antibiotics, a patient experiencing weight loss, a decrease in the platelet counts, which can lead to increased bleeding, and there can be lymph node swelling, which can be palpated in the form of the swellings in the all over the body, and they can also be causing pain in the abdomen in patients who have lymph nodes in the tummy.
इस डिज़ीज़ में डायग्नोसिस जो है वो बहुत मुश्किल से होता है, क्योंकि for 5-6 months he was going through the symptoms, but we are not able to find out कि आखिर में ये हो किस लिए रहा है। हर तरह के डॉक्टर को हमने विज़िट कर लिया, ENT, चेस्ट स्पेशलिस्ट, सबको विज़िट किया, लेकिन कोई भी, सब लोग थोड़े से एंटीबायोटिक्स देते थे, बट फीवर वैसे का वैसा ही फीवर भी रहता था और जो कफ था वो भी वैसे का वैसा ही था। एंड द मोर टॉर्चर वाज दिस, एवरी आफ्टर 1 hour ही यूज्ड टू पुट हिज थर्मामीटर इन हिज माउथ और फिर आ गया, तो इट वाज अ बिग टॉर्चर टू ऑल ऑफ अस।
स्टार्टिंग में तो थोड़ा फीवर रहता था, काफ़ी वीकनेस भी होती थी, चल नहीं पाता था मैं। पहले तो किसी को इतना मतलब बिलीव नहीं हुआ कि ये ब्लड कैंसर हो सकता है।
Whenever we say blood cancer, there are three main names comes into the mind. One is called acute leukemia, the other one is called a lymphoma, and the third one is a myeloma. How these three are connected? Because they all three probably originates from the bone marrow, and that's why they are called the blood cancers. When we talk about the leukemia, there are two types of leukemia. One is called acute leukemia and one is a chronic leukemia. Acute means it comes very quickly, and if you don't treat quickly, it can take the lives. You may not have a symptoms for the long, and as soon as it is diagnosed, it requires immediate action. Chronic, it comes slowly, we may not be knowing it, it may be going on for the few months to a year, and when even if you don't treat, people survive for a few years even without the treatment.
In blood cancer, there are two main cancers that occur in the children. One is ALL and the other is AML. ALL is acute lymphoblastic leukemia and AML is acute myeloid leukemia. These two are blood cancers, and of this ALL constitutes around 75% and 25% is roughly AML.
Acute lymphoid leukemia is more common in the pediatric age group. It requires a long-term chemotherapy. It requires a 2 to 3 years of chemotherapy. Initially is an injectable chemotherapy. After 6 to 8 months is an oral chemotherapy. If it is a pediatric age group, the majority of the patients can be cured with the proper treatment. If the same leukemia, acute lymphoblastic leukemia comes into the adults, the chances of getting cured goes down, and there are many patients that the adult will require a bone marrow transplant also.
Bone marrow transplant, normally we are giving very high dose chemotherapy, and after giving chemotherapy, cancerous as well as normal blood cells are destroyed, and then these stem cells just like blood transfusion, and after that, because patient's blood cells are completely destroyed, they are dependent on various life support for about 2 to 3 weeks of time. Infection that remain the biggest risk during this process, that's why they are nourished as a very protective environment, that is a HEPA filtered pressure air control rooms. They are dependent on regular blood transfusion and platelet transfusion till their marrow start working, that is usually around 2 to 3 weeks of time.
Another form of transplant is called allogenic transplant, when we are taking a stem cell from someone else. Unfortunately, only 1/3 of the patients will have a family matched donor. So worldwide there are many registries. You can have a donor sitting in Australia, Germany or USA. You can do a HLA testing, find a donor, and not a family member, someone unrelated also can be your donor. Recently there is a further advancement. Your family member, even if it is a half matched, everyone has a half matched mother, half matched father, because this is a genetic inheritance, or half matched brother, so we can do a transplant even with the half matched donors also. That is called a haplotransplant. So practically previously the only 1/3 of the patients had a donor and the rest of the people couldn't have a transplant because there was no donor available. Now more than 90% people can have a transplant because of the advancement in this donor pool.
Chronic myeloid leukemia treatment has undergone a sea change over the last 10 years. We have now 5 oral targeted drugs which are available, and with these drugs patients feel absolutely asymptomatic. It is like treating a diabetes or hypertension patient. They just have to take one pill once or twice a day and they feel as normal as you and me.
If you 10 years back, Majority of the patients, if they were diagnosed with the chronic myeloid leukemia, were requiring a bone marrow transplant. Now hardly anyone requires a bone marrow transplant. Chronic lymphocytic leukemia, there are significant changes in the last 2-3 years. There are also targeted therapies coming up. They are in the forms of oral therapies, and they have shown a significant difference in the survival of the patients.
So myeloma predominantly affects three main areas, which is the bone and the bone marrow, leading to decreased bone health and increased chances of fractures as well as severe bone pains and causing spinal cord injuries, even with small trauma, and affecting the kidneys by causing choking of the kidneys by these abnormal immunoglobulins, leading to renal failure.
It's a slow growing disease. Majority of the patients will have a disease for a few months before they are diagnosed. Unfortunately, myeloma still recurs. So there is no chance of, so far there is no cure, but it can be controlled for many years with these targeted therapies. People require targeted therapies to control the myeloma. The people who are below 65, they should be followed by the autologous transplant that gives the best advantage of long-term survival. The people who are above 65, because of the toxicities of the transplant, they are not taken for the transplant and they are only on the targeted therapies. There is a significant survival even without a transplant in the elderly group. The lymphoma, it is divided into two main groups. It's called Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma usually is a two age groups, either it is a very young age, the pediatric age group, or the middle age group.
I was recommended a number of tests including biopsy, and after 15 days it was confirmed that I was suffering of Hodgkin lymphoma. This news was a great shock to me. I was taken aback.
When the patient comes to us, so we need to understand what they know, then how much you have to tell them, how much has to be told in front of the patient, sometimes in front of the patient's parents, and what the family's wish is, you have to explain.
In this 6 months, I have lived a full life. Firstly, I made up my mind that I am going to fight it out, and that was a part of strength. The second strength I got from my friends and relatives.
हमने इसको इस डिज़ीज़ को एज अ नॉर्मल डिज़ीज़ लिया. इसको हमने ऐसे एक हवा नहीं समझा कि ये कैंसर, क्योंकि हमने पहले कभी सुना ही नहीं था कि ये सब होता है. बट इसको हम एक हवा जैसे नहीं लेके एक नॉर्मल डिज़ीज़ की तरह लेके एंड हम सब जुट गए.
Non-Hodgkin's lymphoma, there are many varieties of non-Hodgkin's lymphoma. They are lesser in the pediatric age group. As the age increases, the frequency of the non-Hodgkin's lymphoma increases. The non-Hodgkin's lymphoma also are the two types, and mainly they are low grade and high grade. Similar to the acute leukemia, high grade comes with a short span of time, and if you don't treat them early, you may lose the patient. So they require immediate attention, and if you treat them properly, there are many patients of high grade lymphoma can be cured. The low grade lymphoma, it grows slowly. We may not be knowing for many months to a year, and even if you don't treat, people will survive for the few years.
Especially जब कीमोथेरेपी होती है तो पहले के 2 दिन बहुत ही डिफ़िकल्ट होते हैं फॉर द पेशेंट, और उसके बहुत से मूड स्विंग्स होते हैं. खाने का टेस्ट बिल्कुल नहीं होता, टेस्ट बड्स बिल्कुल ख़त्म हो जाती हैं, और पेशेंट हर टाइम मना करता है कि मैं नहीं खाऊंगा. पर यू हैव टू गिव वैरायटी टू हिम, स्मॉल मील्स बट फ्रीक्वेंट मील्स, और कोई भी रॉ वेजिटेबल या रॉ फ्रूट बिल्कुल इनको नहीं देना था, जिससे कि डिजीज़ कुछ किसी भी तरह उसके अंदर आ सकती थी.
It's a very advanced science now. There's nothing to get scared. Doctors, they know their job. They treat you and follow the doctor blindly.
The future for blood cancer patients is bright. To me, it appears, because every new year we are having a lot of new drugs coming up for these patients, and these drugs include oral drugs. So many of these patients will actually be treated on an outpatient basis, and many of our actual blood cancers are becoming more and more chronic diseases like diabetes or hypertension. And apart from the oral drugs, we have new drugs of immunotherapies which are being available, and they are prolonging the survival of these patients. Another fascinating thing which is happening is engineering our own body's immune T cells to fight against the cancer cells. They are known as CAR T cells, where we modify our own body cells and our own body cells fight against the tumor cells. And the initial trials are really promising, and I'm quite hopeful that the future is going to be bright.
Cancer is no more taboo. Means cancer is there, that's not a death sentence. Cancer is like any other chronic disease has been converted to a chronic disease. People can be cured, people can survive with the cancer for longer. Even the patients who are in the higher stages can be treated, and if they are not cured, at least we can prolong their life for many years with the treatment. Earlier we will find out the higher chances of success.
And friends, tell yourself very strongly that you are going to come out of it. Be mentally prepared, and I am very sure you will be one day fit and fine and leading the normal life. At the same time, I'll request the family members also that don't create a scare for cancer with the patient. It affects him adversely. Just give him morale booster. Keep telling him that he is going to be fine and fit. Keep helping him, and whenever he is depressed, keep boosting his morale. This goes a long way. Apart from the treatment, this carries a lot of meaning.